and welcome to Leading Your HIPAA Culture in 2016. Thanks so much for joining us. We are very excited about this training, and I hope that you've made an opportunity to share this training with others. If you have shared it and it does result in having someone look into HCSI, we do send $200 gift cards, and we'd love to make sure we'd love to send you one this month. Well, I will first start with a quick slide activity. So I want you to take a minute, read through the sentence, and count how many F's you see, and then comment below the video. Okay, how many F's do you see? Okay, just another minute. Okay, so looks like the average, when I went through this the first time, 3 was what came out to me. Well, if you actually take a closer look, there are 6 F's. 6 F's in here. See, what most people forget, they'll get the F in finished, they'll get the F in files and in scientific, but they forget that, well, there is an F in of, and there are 3 ofs. So if you got 3, just know I've tested this on many people, and my wife is actually the only one that said 6. So just don't feel bad. The reason I share this with you, small details are missed all the time. And I've felt this is analogous, this activity is analogous to compliance. Just as the word of helps connect the pieces to this sentence, I think compliance is a huge connecting piece to taking great care of your patients and of your staff. Wanted just to share this with you. This is a picture I saw on LinkedIn of some workmen who are installing cast iron bollards to stop nurses from parking on the pavement outside of the Royal Hospital in Belfast. So here they're depicted as cleaning up at the end of the day, but can you spot why they won't be getting off, getting out of, getting home anytime soon? Well, they've blocked themselves in. Again, a small thing, but you know, this is a real powerful image, I think, in helping illustrate the power of focus. And we hope that you'll make the very most out of this training by closing any other windows down and making sure you sit with us for an hour to go through some things that we think really will help improve your leadership, improve your culture, your team, and improve your patient care. Now, who am I? My name is Lance King. I'm the Vice President of Sales at Healthcare Compliance Solutions. And many of you have been personally invited by me or have been invited by somebody on LinkedIn from our company, and perhaps a colleague. Well, whoever you're invited by, we're grateful that you're here, and hopefully this will help with compliance officer duties and understanding how to take compliance in-house. I'm going to present, and I'm happy to answer any questions if you want to call or email. Now, a little bit more about me. I'm from Salt Lake City, Utah, and many of you probably already know if you've seen me on LinkedIn. I'm very passionate about family time, and a lot of the articles that I write have to do with helping healthcare administration do more with less. boy, I've realized since I've been with HCSI that you people work so hard, you care so much, and you put in so many hours, and I thank you for that. And I think that this presentation is a way that I can give back, that we can give back, help you to get home to your family for dinner, and help you to feel like you're able to take your core abilities and reinvest those to their full potential in your organization. So I know our customers have peace of mind and time for peace as a result of our compliance partnership. And just a little bit about us. We are a healthcare compliance partner. We know a lot of our customers are on this call, this training today, and boy, we sure appreciate many of you have been with us for over 10 years, and we certainly appreciate that. And for those of you who are just joining us, we are so grateful, so grateful. And our mission, just in short, is to incorporate a culture of compliance with HIPAA, with OSHA, with Medicare, and human resource and employment law. And we know this starts with the leaders. We believe that culture is best done when a compliance officer is given all the support and resources needed so they feel like they have some autonomy, so they feel like they can be engaged in these operational day-to-day activities and understand how to communicate that effectively. Well, something else that you may not know about me, years ago, my wife experienced identity theft. And I'll tell you, this was something I experienced with her because we had just been married for maybe, I'd say 4 or 5 months is all. And we didn't have identity theft where a record was breached with us personally. It was somebody that broke into our vehicle. And I don't know why, but she had her purse in there and she had some other valuables that were taken. And we went through years of hassle to get our lives back in order. And boy, in some cases, identity theft can take 300 or more hours to recover from. And that was our experience. Just took so many months. And so one point I like to illustrate with this is that, hey, patients expect that their information is going to be kept safe when they go to your practice. And so please keep in mind that this presentation is for the patients. We know it's tough, but it is for the patients. Now, real quick, just a kind of an overview, a laundry list of things you can look for in this presentation. Well, we're going to talk about leading your culture, selecting the team in terms of who's going to be overseeing compliance duties, learning on an ongoing basis. And this has to do with privacy, security, and I put safety because I believe a lot of this really does keep people safe. We're going to talk about a HIPAA breach and how to identify it, as well as some of the exceptions to a breach. HIPAA protections with security risk analysis and social media in particular. Compliance training. And then we'll go through documenting your process, your findings, and your actions, developing an action plan, and mitigating risk. Okay, so there's a quick snapshot of what we're going to go through, and it will involve leaders understanding the regulation and how to implement it adequately and effectively. And so we realize that this presentation isn't a complete training. Certainly, there's more that we can talk about with HIPAA. There's a lot to it, over 800 pages if you really want to get to the nitty gritty of it. And so further recommendations can be provided, and I'll provide my email address again at the end of the presentation should you request some additional help. Okay. So in leading your culture, we realize we've all got 168 hours in a week. There's only so much time that can be put into your work. And indeed, work and family life and recreation, you really have to separate it. You'll notice to the very, very right, a lot of times compliance, well, that glass is left empty. And so I just want to again help you to do more with less so that you can add to that glass. You already spend too much time as it is, so let's try to simplify things the best we can. So again, though we're not always the top of the totem pole priority list, HCSI has been very helpful in helping to move that up the list as we've helped people understand how to lead a culture. One tip I will give you, and this is a tip that came from Rory Vaden, and I implement this in what I do in my life. So say you've got a decision, one of the decisions in front of you. How do you get it up higher on the priority list? Should it ever get up higher on the priority list? Many of you may say. Well, let's take a look. So accounting, for example. Accounting is a decision where it may be something that before you even get your work started in the day, it's put in front of you. Doctor says, hey, I need, or an office administrator says to a doctor, hey, I need this, these accounting things updated. Can you get this done? So you look at that decision, and here are 4 questions to ask yourself. Please write these down. So first, can I eliminate this? Well, if this is accounting, probably not a good idea, right? Next question is, can I delegate this? Well, that can depend on the size of the practice, right? Third, is this something that can be automated? Well, a lot of people have accounting companies that will help out. The next question may be, can I procrastinate this? And that's where it may go down to the bottom. You'll see this, you'll see healthcare compliance at the bottom, because in many cases, there is much that can be procrastinated. But if you haven't, at this point of the year, done your healthcare compliance, a lot of people will do it at the beginning of the year, or they'll have a point in time at some point of the year where they'll do it. But if you haven't done it, my goodness, this should be right up under patient care. So I'll have some ideas for you throughout the presentation on how you can do this in-house. Now, in-house, just in kind of getting a checkup from the neck up, is this a picture that you may have at your office? I love this. Oh, that's a time-saving system we came up with. If we ever forget our username or password, we just look it up on one of the sticky notes. Well, if this is the case for you, we would encourage a system that's a little bit more, patient information secure, you may say. So if this looks familiar, you may have a system, but let's see if we can improve it a little bit. Why? Well, audits are definitely increasing as a result of things like healthcare apps, increase in online resources. And a lot of times it's because people are still using paper records, which is why there's been so much incentive with the HITECH Act to get people to electronic health records. So healthcare records then are brought to the cloud. People are storing things online, and it's creating awareness for hackers and puts a target on your back, certainly. Additionally, mobile devices are becoming more and more used for communication. And so all of these are reasons why it's important to create a culture of compliance. And when we talk about culture, what are we really saying there? Well, we're talking about something that's ongoing, something that's integrated into the duties that take place on an ongoing basis, and it's something that represents the values of your culture. We think this should be an absolute value, a standard to making sure patients, if they're at the top of the list in patient care, this really should be synonymous, this HIPAA security. Now, furthermore, if you look at this picture, here are a number of ways that patient information, just to expound on it a little bit more, is being put in jeopardy of being breached. As technology advances, there's more platforms, more applications, and more people in some cases as you grow to transfer patient records. So we need more security protocols. Unfortunately, this analysis comes as a result of regular breaches that I read about weekly. And I think you probably do if you're connected with us as a customer. You see a lot of the real challenges that are happening. So the following you're seeing in front of you from the top, we'll just go clockwise. The first is advancing electronic medical records with tablets. Okay, these are being breached. Email services like Gmail. If you're using this to send protected health information, stop it. That is absolutely junk when it comes to encryption. There's nothing there. So if you're sending anything to patients, boy, that is a very easy system to be hacked. Okay. Upcoming medical advancements, such as the Johnson & Johnson insulin pump. This is a pump my neighbor actually uses for his daughter. And this is becoming a huge threat. In fact, Tuesday of October 4th, there was an article published saying that Johnson & Johnson is telling patients they've learned of a cybersecurity bug in this new pump that a hacker could exploit to overdose diabetic patients with insulin. And that is a very scary thing for parents. As I talked with my neighbor, it's something that made him a little nervous. They decided to give this a shot, and then this information comes out. Medical device. Just so you know, medical device experts do say that this is the first time a manufacturer had issued a warning to patients about cyber vulnerability. So this is something that's just coming up out of the woodworks a little bit more. The next is paper records. They'll always be an easy target. I remember walking down the street not too long ago and literally had some patient records blow in the wind and land next to my foot. It was the weirdest thing. It was very weird. So I contacted the company and let them know, hey, I've got some information I shouldn't have. And it's just easy to misplace records. Sometimes people will take them home on accident or put them in the trash. And I think these records were put in the trash on accident. So business associates, such as IT companies, accounting firms, and others who need to view protected health information. And then information communicated via text or instant messenger up at the top. So the audit timeline, why do we say that this presentation can save you 3 months? Well, from left to right, this is the audit timeline. Okay, this can take 90 days or more depending on how much an auditor needs to dig. So first, day one, they notify you through an email or mail. And from there, you're given instruction on which documents OCR needs to see. They'll have a space for you to upload those documents on their website. And then they'll also have space if you don't have the document to outline what you need to be doing. They'll then, on about day 30, after they've gone through your documentation, to be effective as auditors, they'll do some on-site field work. That field work then moves into drafting an audit report, which can go through some revisions before you see it and comment on it. And then you have a final audit report, and hopefully you don't have any fines. But boy, if they have to dig, they're likely to find things. So why not have an audit binder, something that contains all your policies and your procedures, your training certificates, everything an auditor would want to see. And that's kind of what I hope we can unpack. And hopefully you're able to see how this can be done in-house or something that you can then automate or delegate or outsource to someone else. So 5 circumstances that are very common: disgruntled ex-employee, self-reported breach, employee activists, patient's fear of breach, and random OCR visit. So disgruntled ex-employee, very simple case of the employer turning you in because they want you to get back to, they want to get back at the employer. Self-reported breach is actually required by HHS. Now, the employee activists, well, that just may be something that somebody anonymously contacts OCR. Patients, number 4, they believe their information may be breached, or they believe someone else's information is in jeopardy, and a lot of times this is a family member here. And then lastly, OCR is randomly visiting practices, more desk audits this year, and more on-site audits next year, as they've been talking about. Now, the real 3 that we think you need to worry about are disgruntled ex-employee, for starters. Now, here's a scenario that may be pretty common. So you have an underappreciated office manager. They're tasked with several more responsibilities that they can handle. Now, probably not your position, right? Right. So high demands cause stress. And let's say in this scenario, the doctor isn't necessarily the easiest person to listen to, or not the easiest person to talk to, because of all the things they have going on, and they don't really want excuses. They just want things to get done. Okay, doctors, if you're listening, does this sound like any of you? It could be an instructive scenario. Well, the office manager in this scenario becomes wound so tightly that she begins looking for ways to get back to the doctor. Kind of, hey, I need to stick this to the man because, boy, you're not listening. So let's show you how valuable I am. So more so looking for the doctor to screw up and then not running to his or her aid as quickly. So it finally happens. Doctor makes a big mistake that the office manager could have saved. The result, a very angry patient and a very, very, very angry doctor. The doctor's buildup of dissatisfaction results in the office manager being fired. Now, here we go. The office manager blames all the responsibility being put on her and her alone. Boy, this is a familiar scenario. I've heard it many, many times of many office and practice managers. And in this case, it's where we have, and most of our customers have anywhere from 3 to 10, I would say on average, 3 to 10 staff members. And so the office manager feels severely understaffed, underpaid, and underappreciated. Now, we shouldn't blame the doctors for poor leadership, but in my opinion, we just need to keep improving on our own leadership. Okay, there's so much we can do. Part of leadership is communication, and finding ways to communicate to the doctor in the way that the doctor understands, or a way that the practice administrator understands, I think is absolutely essential. Okay, so while recently visiting with a consultant on the phone, I'll just say, we'll call her Sally, I did discover she had been an office manager who indicated that one of the main reasons that she became a consultant was because she'd been exhausted from overload and underappreciation. And she shared many instances where the practice was in breach of patients' information, but that the doctor just wouldn't consider the consequences of the situation. Disgruntled patients would be the second part of this. Again, a story that may come across as being very common. So in this case, the doctor decided to vomit out a patient's prognosis in front of the people that were surrounded by the patient. And we'll call the patient Dave. Now, Dave, a very sensitive subject for Dave. He didn't want anybody that was around him to really know about the circumstances. And when the patient had the doctor vomit out everything, or when the doctor vomited out everything, the patient got upset naturally with the doctor. And then the doctor, of course, came back. They had a little communication ping pong match where the doctor barked at Dave that, hey, Dave, you shouldn't have had all these people present. There should have been some communication to me from the nurse or somebody else that I should have kept this more safe. And so they go back and forth, and regardless of who was at fault, the situation escalates into an argument that neither side apologizes for. So Dave leaves the room, storms off, and actually this story was told to me by Sally, that consultant I just mentioned, and she said she was assisting the doctor in the discussion and knew that they could really get in a lot of trouble if the patient complained to OCR, because there was other things that they weren't doing. So she encouraged the doctor, "Hey, doctor, you need to call Dave right now. This could be a big deal for our practice if we get audited." Well, the doctor said, "No, I'm not going to do it. This, hopefully Dave will learn next time." Well, Sally said, "Well, actually, if we get audited, then it'll be us learning next time. So do you want to call?" Well, the doctor said no again. Sally then had to step up, and again, as a leader, had to communicate. And this doctor wasn't listening, so she had to get very frank. She said, "Doctor, you will call him, and you'll do it now. This is my career, not just yours, and everybody else's here in the office. It's our reputation, our integrity, and our responsibility. Call the patient and apologize now." The third, lack of security protocols can cause an audit. We've talked about many examples, but I will say recently a well-known security encryption software that many dentists use received a $275,000 fine. If you want to know who it is, I'll share that with you later. And why? Well, OCR for years had tried to tell the practice management company that their security protocols just simply didn't meet HIPAA requirements, and they did not listen. Well, I guess they did listen, but after nearly $300,000 later. So yeah, kind of a mess. And the real issue, is it the fine? Probably not. It's what's happening with patient records when they are breached. Did you know almost 30 million patient records have been compromised since 2009? Can you believe that? I mean, that was around the time when people were really starting to bring things online. And that's according to InfoSec Institute. Now, when we look at this a little closer, stolen patient health records, a lot of hackers, they get $363 is the highest I've seen per record. And that came from the Poneman Institute. And that's more than any other piece of data from any other industry. So is it any wonder that more security protocols and HIPAA, the reason they're doing so many more audits is because of the seriousness of these breaches. Now you may say, well, why is patient health information considered more valuable than financial data? Well, while a stolen credit card can be canceled and fraudulent charges disputed, as it was the case for my wife and I, with this, the process for resolving medical ID theft, it really just isn't straightforward. So now I'm going to really get into the heart of this presentation, this training. It's time to really start taking notes. Okay, so we're going to talk about creating a culture of privacy and security. We've talked a little bit about culture and how it's becoming one of the biggest challenges facing healthcare providers today because of all of the duties and responsibilities of healthcare compliance officers / office managers / in some cases doctors. And so we think privacy and security is best achieved when the overall atmosphere in your office emphasizes confidentiality and of patient information. So leaders that develop this culture, they're going to do three things. First is consistently communicate your expectations that all members of the workforce protect patients' health information. The second, you're a guide. Leaders, you're a guide. The focus shouldn't be on you and on what you have to say, but you're a guide in helping the staff, helping your team to comply with, to implement, and to enforce your privacy and security policies and procedures. And number 3, remind your staff of why keeping this health information confidential is so important to patients and to your practice. This should be done in staff meetings, or I think the best opportunity is to do it impromptu when an opportunity to instruct surfaces. Now, in order to maintain a culture of compliance, you must understand what a breach is. Well, according to HHS, a breach is generally an impermissible use or disclosure under the privacy rule that compromises the security or privacy of the protected health information. And we read here, unless the covered entity or business associate, as applicable, demonstrate that there is a low probability that the protected health information has been compromised based on a risk assessment of at least the following factors. Okay, and I'm going to go through 4 here. The first is the nature and extent of PHI involved. Now, that includes the types of identifiers and the likelihood of re-identification. Again, if you have any questions on some of these, I'm not going to have a lot of time to get into a lot of detail, but we certainly can after the fact. The unauthorized person who used the PHI or whom the disclosure was made. Whether the protected health information was actually acquired or viewed, and the extent to which the risk to the PHI has been mitigated. Now, the last thing I'll say for healthcare practices, of course, they're called covered entities by OCR and business associates. Where applicable, you have the discretion to provide the required breach notifications following any impermissible use or disclosure without performing a risk assessment to determine the probability that the protected health information is compromised. So please identify with your responsibility. This is, again, the integrity and the reputation of your practice, okay? So a HIPAA breach. Suppose a member of the staff just accidentally mailed out or emailed an appointment list for the day containing patient names, dates of birth, social security numbers, and phone numbers to another patient along with their new patient packet. So the question is, what do you do? Does your staff know who to go to for leadership when there is a breach? Okay, has someone been designated as, say, the HIPAA officer in the front office? Of course, if OSHA is applicable, is there somebody in the back office? Does the designated compliance officer understand the necessary steps to take in a breach notification? And does the HIPAA compliance officer know where to receive ongoing guidance? So Congress has created extensive breach notifications requirements, and that's part of the HITECH Act. I've mentioned that earlier. And here's what you'll need to write these down. If you have any questions, go ahead and write those questions underneath the presentation in the comments section. Just scroll down on your screen. You'll see that there. Okay, so I'm going to go through these pretty quickly. So after a breach is discovered, here's what you need to do. You need to provide notification to each individual whose PHI was breached, and that has to happen within 60 days. Okay, and that notification, it should include a brief description of what happened, date of breach, and date of discovery. Okay. Next, as far as a description, you need to state what type of a description of the type of PHI that was involved and the steps the individual needs to take to protect themselves from any harm. a lot of patients are going to have no clue of where to go after something like this happens. Next, with corrective and preventative action, a brief description in this notification of what the office is doing to investigate, mitigate your losses, and protect against any future breaches. And you need to make sure to include any contact information for individuals who can ask questions or attain any additional information. Again, this is something that can take 300 hours for a person or more. And I get that number from some of these security companies that help with identity breach. Now this should be this written notification should be sent first class mail or email if that's the preferred communication. And then if you have 500 or more individuals, you need to identify which media outlets, which prominent media outlets need to be made aware, and report all of the breaches you have to HHS. And actually that's to the Secretary of the Health and Human Services. Okay. Now, there are 3 exceptions to the definition of breach, pretty commonplace, but the first exception applies to the unintentional acquisition, access, or use of PHI by a workforce member or a person acting under the authority of a covered entity or business associate. If such acquisition, access, or use was made in good faith and within the scope of authority. The second exception applies to the inadvertent use, inadvertent disclosure of PHI by a person authorized to access protected health information as at a covered entity or business associate to another person authorized to access the PHI at the practice or at the office of the business associate or organized healthcare arrangement in which each covered entity participates. In both cases, the thing to know, the information cannot be further used or disclosed in a manner that's not permitted by the privacy rule. Okay. The third is, and we've talked about this a little bit, the exception applies if the covered entity or business associate has a good faith belief that the unauthorized person whom the impermissible disclosure was made would not have been able to retain the information. So those are some exceptions there. Okay. So some key components. There are 9 here, so get ready to write them down. Help ensure the privacy of protected health information. Give patients more control over their information. Establish appropriate safeguards that healthcare providers and others must achieve to protect the PHI. Please hold violators accountable with civil and criminal penalties if need be that can be imposed if patients' privacy rights are violated. And if you don't have sanction policies that you've already developed, this is something you should talk to us about. Strike a balance when public responsibility supports disclosure of some forms of data, for example, to protect public health. 6 is enable patients to find out how their information may be used. Okay, this should be something at the very beginning with your notice of privacy policies and about different disclosures of information that have been made. Limit release of information to the minimum reasonably needed, and that's for healthcare providers and business associates especially. As you're exchanging information, the key there is minimum reasonably needed. Give patients the right to examine and obtain a copy of their health records, and empower individuals to control certain uses and disclosures. And we've talked a little bit about that. So those are some HIPAA protections and key components there. Here are some risk protections, 3 specifically. The physical, technical, and administrative measures should be addressed in your HIPAA security a focus on internal and external security threats, including breaking through the network firewalls, email attacks through interception or viruses, compromise of passwords, and computer viruses. Now, one thing I'll say about passwords is I met with a gentleman just the other day, and I'll be sharing some of his recommendations of what to do with HIPAA protection, risk protection. He mentioned that as far as passwords, a lot of people, they get frustrated because they need to put in, change passwords every quarter or every 6 months. What his suggestion was every season, perhaps have a different password that relates to what you like about the season. So right now it's fall. So you could say, I love the autumn leaves, and that could be your password. And I'm actually going to have this individual, I'll be sharing some more of his recommendations in an upcoming webinar to give you more information about this. But I thought it was pretty instructive that really, if a hacker or a system is trying to hack into a healthcare provider's network, it has to go through every single letter. And the longer the password, the more challenging. So it could be, I love fall leaves, or I love the amber colors of fall, something to that effect. Last here is assessment of and preparations for security risks in hardware, software, facility, and environment. So 7 steps to HIPAA compliance. Understand the rules. Okay, if you're going to lead, you need to understand what's being communicated. So review the regulations, learn about HIPAA. Assign responsibility, appoint compliance officers. Again, we talked about this decision-making process, these 4 decision-making tacks of eliminating, automating, delegating, or procrastinating. In this case, assign that responsibility. Have someone else do it so you can apply your core competencies. List all your PHI systems. Okay, what are you using? Are you using cell phones to communicate? Are you using tablets? Conduct a risk analysis where you're assessing the vulnerabilities, prioritizing risks, identifying security measures. Certainly implementing your policies and your procedures, and I'm going to focus on implementing again. There are so many ongoing policies and procedures that need to be implemented. Okay, and that goes along with, and really what I mean is that you're documenting throughout the year, and there are a lot of forms that go with this. So document all policies and procedures. Document a method to address your security policies. Select security controls that then match your policies. Okay, and then you'll have a training program that you'll train and document your training and conduct with your staff. And you want to make sure there's an initial training, say 10 days after somebody comes on to the practice, and then make sure, we suggest quarterly, you have some sort of training. Okay, so this could be a good training for that quarterly training that you're watching today. All right. Monitor and document ongoing HIPAA progress. So if you're watching this for ongoing training, make sure that you have initialed and a date on a paper that says that you went through this training. Okay. So monitor and document ongoing HIPAA progress and compliance. And that goes so far as, auditing, that we have audit forms, privacy and security forms. Monitor how things are going. Test your privacy and security program at least once a year, and integrate privacy complaints and security incidents. So more with security analysis. Okay, and we'll talk about 3 things specifically. So again, identify where your PHI exists in your practice and how it's created, how it's received, maintained, transmitted, including in your electronic health records. Okay, and types of risks to your electronic health records maintained in your EHR will vary depending on whether your EHR is based in your office or whether it's hosted in the cloud. Identify potential threats and vulnerabilities to PHI. And those include human threats such as cyber attack, theft, or workplace members' error. And then natural threats, we're hearing a lot about those, such as earthquakes, fires, tornadoes. We've got a lot of hurricanes going on, just a lot. And then environmental threats such as pollution or power loss. So vulnerabilities are flaws or weaknesses that, if they're exploited by a threat, really can result in a security incident or a violation of policies and procedures that can cause a lot of damage. Then identify risks and their associated levels of high, medium, or low. Okay, so categorize them. And this is done by assessing the likelihood that those threats will exploit vulnerabilities under the safeguards that you have in place, and by assessing the potential impacts to confidentiality, integrity, and availability of PHI. So the game plan is you must start with your HIPAA compliance officer, right? They need to assess these potential shortcomings in how your practice is protecting patient information. Your game plan should be about discussing findings. And again, this is a great time of the year to discuss those and solutions. And you may involve the electronic health record developer. That's and IT. Okay, that could be critical. And then keep the documented results of your analysis in a compliance folder, some sort of a binder where if an auditor comes in, they can quickly flip through a book to security analysis and see all the ongoing efforts, changes, and implementation of things that you've put to again remedy the different risk factors that you find. Okay, I think if you have any questions on this, let us know. I can also help in the risk analysis department, and I'll tell you what I mean in just a minute. So risk analysis, it produces results, and many of which they can fall into gray areas. But a big part of this is you really want to see where you're meeting, not meeting, or exceeding HIPAA requirements at any given point in time. And so take advantage, please take advantage of the flexibility that the HIPAA security rule provides, which allows you to achieve compliance while taking into account that you have a very unique practice. Okay, there are characteristics of your organization and of your environment that are very different from those here in Utah. Okay, and so it's important that your security plan is feasible and affordable, and that you're not doing it every month, but even if you did it semi-annually, that's enough. And if you haven't done it at all, make sure you get started. And over time, you'll find your documentation folder will really become a tool for review that helps out with security. So some tips and leading out in this effort. Educate your staff about the iterative and ongoing nature of the security analysis process. Okay, it's key that they're on board. Make security a high priority in your culture. Have an action plan that clearly assigns responsibilities for each risk analysis component, because there's, again, as I've gone through these things, there's a lot to it. Involve your EHR developer and ensure the risk analysis is specific to your practice. Okay, that's kind of a review. Now, this individual that I'll be having on an upcoming webinar will be talking more about HIPAA security tips. If you've seen our blog at hcsi.blogspot.com or gone to our website and found our blog there, these 10 tips, they're going to save. If you're in a smaller practice, they're just going to save you so much time, so much money, and really make sure your reputation is solid. So again, we'll discuss next week more on helping you understand your risks related to security and some of the safeguards. And small businesses, they face the same types of risks as bigger companies, but really it's the staffing and the resources to respond to the same types of risks as a large organization that really makes things challenging. And so these 10 tips, they come from Opsis, a company that we've recently been introduced to. And they're always asked, what cost-effective recommendations would you make for my business that could make it more secure? And so have a written security policy is one. Encrypt everything is another. Protect your website. Data backups. Avoid consumer-grade products. Know your risks. Plan for bring your own device. Who's guarding the sheep as far as IT and others viewing things like payroll, HR files, etc. Physical security is information security, and know when and who to call for help. So there's a lot more detailed information in our blog if you want to take a look at that. If you have any questions, I'll have my email address in just a minute. So some low-cost, highly effective safeguards we will give you and get in a little more detail is as far as staff requests to take home laptops or other portable devices containing unencrypted PHI, just say no. Okay, that's probably the simplest, low-cost, effective safeguard, right? And then remove your hard drives from old computers before you get rid of them. Computers change really quickly, and if you're doing an upgrade right now, get rid of those. Again, don't use EPHI email. Don't email EPHI unless you know the data is encrypted. Make sure your server is in a room that's accessible only to authorized staff, and keep the door locked. I know here in Utah there are vaults for information, and these vaults you can put information and back it up on a regular basis. And if you ever had anything happen to your facility, you just go to this vault and you have a copy of everything there. So kind of take a look and see what you have in your area. Passwords, we've gone through a little bit of some of the recommendations, but just make sure your office understands passwords shouldn't be shared or easily guessed. Notify your office staff that you are required to monitor their access randomly. Okay, and this will make sure people don't get offended. If you just say this at the beginning, they'll realize it's just part of your culture. Maintain working fire extinguisher in case of a fire. And then the last one is just check your EHR server often for viruses and for malware. Now, we will talk just briefly about social media because, well, most healthcare practices seem to be using a lot more social platforms. And undoubtedly, it's a very powerful tool for connecting with patients. The thing is, just make sure you have a signed patient release if you're posting any type of PHI or pictures on social media. Okay, patients that have a good experience, that are happy to share their stories, that they can waive their privacy rights. All right, so just know that. So to ensure your office maintains HIPAA compliance, make sure to create policies like access controls of your practice's social media pages. Keep the login information limited only to the minimum necessary staff members. Make sure it's purposeful and intentional. And then limit or prohibit staff from accessing their personal pages while at work. And then as far as connecting, yeah, prohibit your staff from linking personally to any patients. Request a signed HIPAA waiver. HIPAA puts the burden of reserving patient privacy squarely on the shoulders of the provider, but an individual patient can't always waive those rights. I just mentioned that. So I have a simple waiver available for patients, releasing the healthcare provider to share their information for marketing purposes, and that'll satisfy this necessary documentation. Ask me if you need to, and I can send you an example. And then just train all your members of your staff on your policies to make sure that they're aware of what should and shouldn't be shared. Okay. So compliance training in our country, it's mandatory for privacy and security training. that it's documented and ongoing, okay? And so enable your compliance officer to gain a full understanding of the rules and allow them to train, allow them time for training themselves to understand their own role. If they haven't had compliance officer training, boy, that's one thing I know HCSI provides that really makes a difference in helping the leader in that compliance officer role to understand how to have that autonomy, how to feel like they can be engaged in the compliance part of everything, and how they can help keep people accountable. So there's many different types of ways they can be trained and have staff trained online, in office, or outsourcing it. Really what you have to figure out is how much time will it take to prepare a training course, to get all the information and to train your staff. Okay, that's really what you've got to consider. Recently, I spoke with an office manager who she said she had been trying to develop her HIPAA compliance program for the staff. She said she had blocked out some time to work on the training, but every time she sat down to write it, she was interrupted. And there were several attempts and months went by with no training course written. So it can be costly and a huge time investment in-house, especially for smaller practices. Now, as far as outsourcing, if you were to hire a lawyer to prepare a customized program, we've heard it can cost somewhere in the neighborhood of about 20 grand. And again, that depends on the size. And then you can also have a consultant help out, but you know, then you kind of become dependent on them, and it can be very costly as well. So workforce education and training. So what I want to say on this, workforce education training and a culture, plus a culture that values patient privacy, it's just necessary, a very necessary part of risk management, okay? And all of your staff, the doctors, nurses, employees, volunteers, training, and contractors supporting your office, they need to know how to safeguard patient information in your practice. So your training program, whatever you create in-house, should prepare your staff to carry out your roles, their roles and responsibilities in safeguarding patient information and complying with the HIPAA rules, the policies and procedures, and reinforce this training with several reminders and staff trainings as needed. The most important thing is to make sure you're really leading by example. Okay. So your practice again must educate and train individuals at the time they're hired or contracted out. And then industry best practices suggest everybody should be trained at least once a year. And at any time there are changes in the policies or the procedures. Anytime there's changes in the systems, your location or infrastructure. Certainly responding to a breach or a disclosure. So documenting the process, the findings, and the actions. Okay, this can be something that can be a lot less effort. Okay, it can be very much an effortless thing as long as you know which forms you need to be filling out on an ongoing basis. Okay, we'll move through this pretty quickly. So documentation of risk analysis and HIPAA-related policies, procedures, reports, and activities. This is just a requirement under HIPAA. It's also a requirement for CMS, the Centers for Medicare and Medicaid Services, okay? And so examples of records to retain, your policies and your procedures, security risk analysis, training materials, business associate contracts, EHR audit logs that show both utilization of security features and also the efforts to monitor your users' actions. Risk management action plan or other documentation that shows the safeguards, implementation, timetables, and then the notes that you've developed as you've assessed things. And then your security incident and breach notification. So your policies and your procedures with respect to protecting patient and healthcare workers, your policies and procedures guide your practice, guide how your practice operates on a day-to-day basis. And so you should at minimum accomplish a few things. So establish your protocols for HIPAA, for OSHA and Medicare, all that are applicable. Commit to compliance training for all new staff when hired. Instruct your team on what to do when something happens that impairs the availability, integrity, and confidentiality of patient records or other safety incidents. Sanction policy for any violations of privacy, security, or breach notification rules or your policies and procedures. And again, ask me if you need help on this. Your sanction policy must be applied consistently as it's written. So make sure if you have those that you're reevaluating that. And then detail enforcement, okay, starting with the use of EHR security audit logs to monitor access, use, and all the disclosure of patient information. And this is specifically, again, the business associate contracts that details their specific responsibility to comply with privacy and security, okay? Okay, 3 just quick things, some guidelines for employees to help create and maintain a culture of compliance. So employees and visitors wear name and ID badges. Speak softly and use non-public areas when talking about patient information. And the last one is only access PHI on a need-to-know basis. And the key thing is in order to perform your job function. Okay, if it's not part of your job, then no need to look at it. Some simple steps to take at the workstation to promote privacy and security. Keep the documents with PHI out of unauthorized view. Make sure that PHI is shredded or disposed in a secure container. And then workstations and computer monitors, of course, positioned to prevent anybody from looking at the information. Protect passwords and user IDs, and make sure that computers that aren't being used automatically return to a login screen by the user when they're not in front of them. 4 quick guidelines when accessing HIPAA privacy and security. Guidelines with access. So controlling access in certain areas of the office, it's just going to promote that, again, minimum necessary information that staff really need to see. So as far as computer rooms, access to the computer room should be restricted to unauthorized personnel. Backups of PHI are secured in a safe area off-site or not near any public area. Copiers, fax machines, or printers are limited to authorized staff. And then office doors, filing cabinets, and desks are closed and locked when they're unoccupied. And then if you have an alarm, good idea to get that thing set. So it's been said, by failing to prepare, you are preparing to fail. Some have said Benjamin Franklin is quoted for that. So when your office is ready for an emergency, you will be able to take care, you will be able to care for your patients. So just a few things to make sure you have: smoke detectors, fire extinguishers, computer equipment plugged into surge protectors, and where appropriate, using an uninterruptible power supply is our recommendation. Cybersecurity needed where EHR is locally installed in your office or accessed over the internet from a cloud service provider. And then having an action plan for access to ePHI in an emergency situation. Okay, so the action plan moving forward. So as far as audit preparation, the Office for Civil Rights says that it makes sense to audit healthcare organizations of all shapes and all sizes. After all, one of the goals of the audit program they have is to spur across-the-board compliance with the HIPAA HIPAA rules. And so the best way to do that is to scrutinize a variety of providers. And many of you have probably been audited with a desk audit this year. So virtually any organization that is audited is going to have compliance issues. So what OCR will say is they just urge everybody, make sure you document in advance, because they're going to be asking for those forms. And then a couple of quick tips, again, with audit preparation. A lot of this is kind of in summary. Make sure that you have a risk management plan. Make sure there's evidence of a risk management plan. So list all the known risks and how they're being dealt with. Business associate contracts. Take a look at your inventory of business associates and relevant agreements. Have understand where electronic protected health information is stored, how mobile devices are being secured and tracked. Document on breach reporting policies and incident response policies and procedures. Have a record of compliance training that has been completed and an evidence of encryption capabilities. And then how do you mitigate risk on an ongoing basis? Well, ongoing training and culture maintenance. So recently a student, healthcare worker, Catherine, was fired from the University of Iowa Health Center for violating the privacy of a pregnant female student and her well-known student athlete boyfriend. So for over 14 years, Catherine had received HIPAA privacy training, but that didn't stop her from revealing out loud, at least to one nearby coworker, that, well, she just said, hey, I hope the couple was very happy with the positive results of the pregnancy test. So Catherine went so far as to point out the student athlete this was a clerk, after she noticed him waiting, the athlete, the boyfriend, in the waiting room. And then she inappropriately accessed the patient's chart at least twice, opening the records from past visits and medical records. So not a good thing, because the clerk went and spoke with two of the medical assistants who treated the female student and asked about the couple's reaction of the positive pregnancy test. Yay, so exciting. But that, resulted in a report to the manager as a possible privacy violation. So this can happen all the time. A very casual situation. I was talking with a physical therapist yesterday who's in a small town where he says everybody knows everybody, and people get curious. And in fact, record snooping, we have a whole training on it because of so many different scenarios that have caused huge breaches of massive fines. So all I'm going to say is deliberately create a culture that emphasizes PHI confidentiality. And you can do this in a few ways. Speaking often about the importance of trust in a patient-provider relationship. I think this is huge. Just constant reminders about to the team that patients expect that their practice is going to be a good steward of their information. And that involves reminding them to safeguard patient confidentiality and security of EPHI in training, making sure they have a copy of the policies and procedures for easy reference, or they know where it's at, and then reminding them to comply with those. And then addressing staff's questions as they have them, and reassuring of everybody's role. So as far as the training is concerned, I have concluded now with my recommendations on leading a culture of compliance for HIPAA in 2016. The next part of this, I want to identify some pros and cons. You've now had a little bit more than a snapshot of how to address HIPAA in your practice, and how to do this in-house, how to get things written up. You may have some pros and some cons now that you're understanding more of what is in store with HIPAA, what you're responsible for. And so I want to talk about, what if, at this point you're feeling overwhelmed and you're ready to shake hands with a consultant to come in and do all this for you. Well, that is an option. No, we're not going to do that for you, but that is an option. Creating the policies and the procedures, implementing them, training your staff. Okay, all of that, again, needs to happen on an ongoing basis. And a lot of consulting companies, they'll charge about $1,200 a day to come in and they can do that for you. Okay. So I'm going through just a couple of options so that you can have success at this. Now, if you want to email me, I'll send you a risk assessment that gives you a 360-degree view of what's going to be required. You can start listing some of the remedies that you have for different risk factors. Or you may consider a company like HCSI. We do online training. Okay. So just take into consider some of the options you do have. You can go to a consultant. You can determine in-house is the best way to do this. And I've given you a lot of resources that you can go back through, review, and begin putting in the time. And if you're not going to put in the time, you may consider a company like HCSI. Okay, but you've got to evaluate things financially from a time position. And again, where you're at this point of the year, this may be a perfect time to begin getting things in order. Now, with HCSI, if you find that the compliance starts peeking its head, the three things that we do is, we have the training's online. We have a website portal for all the compliance plans and everything that's created. All your staff will be trained there. All your forms are customized, and we have compliance binders to put all the certificates from all those that have trained, all your compliance policies and procedures, your forms. Did I say risk assessment already? And then we provide ongoing support, and that is specific to the compliance officer. So I'll talk more on that. So from here on, I'm going to talk a little bit more about HCSI. If you're interested in looking into HCSI, here's what you can expect. So as far as training, we do more than just HIPAA. We do OSHA, Medicare, and employment law. We provide the binders. In fact, we provide 4 binders now: reference guide, compliance plans binder, certificates binder, and then we have one for business associate contracts. We've done the business associate contracts because we've had so many people audited and fined for not having business associate contracts. In fact, just last week, I was reading an article, and I can send it to you. Women's clinic was fined. I think it was the ballpark of close to $550,000. So a pretty big women's clinic back east. So you're going to have a lot of, you may have a lot, you may have a little, but we have a whole binder for that. And then the compliance plans and audit manual, as you can see in front of you, this is for the auditor. If an auditor comes in, they may take minutes with you instead of 3 months with you. And the reason being is this binder has tabs with HIPAA, with OSHA, with all the information that an auditor is going to need to see. So we make this really simple. Okay, and this is one of the main reasons people go with us, is just because, hey, everything's customized, everything's going to give the auditor what they need to see. Things are changing. Okay, we've been addressing all week some recent changes that have taken place from HHS. Again, if you're interested in knowing about some of those changes, send me an email. I can send you a list of things. But we do send weekly and monthly updates. Quarterly newsletters actually mailed to you, and that newsletter is exactly what you're seeing in front of you. And at the top right, you can see there's kind of a red area. After training has been done on this training advisor, you'll have everybody initial and date that they were there. Phone and email support. After changes come out and we email you, again, last week we had to email something. We emailed some information, and actually it wasn't specifically HIPAA, but it was pretty close to HIPAA, we thought we'd notify everybody of what HHS was doing with Section 1557. And we just provided the information, said, hey, it's expected that you have this information up by Monday. That was the deadline. And so sometimes you may find that information, we do that just because we care about you. We want to make sure you're up to date. And then a quarterly assessment is something we've just started doing in 2016. So what is that? Well, what we do is we realize that after a compliance officer has gone through training, a risk assessment, customized the policies and procedures, had staff train, they now have looked at almost 100 forms that are required, that it's kind of like drinking from a fire hose, right? It's a lot to take in. So we unpack things quarterly by calling the compliance officer and helping them understand how to lead their culture. Okay, we do an evaluation of what has and has not been done in the training and the risk assessments, etc. And then we make recommendations, especially if there are some changes with the regulation that need to be reflected in your program. There are a lot of forms. Here are just some examples. I'll also say we provide posters as well. Here's a customer testimonial, just a fun one. Dennis, I appreciated this because an employee filed a complaint with OSHA. They've actually used us for about 5 years now. So just a nice testimonial there. Here's an example of a patient. Somebody turned them in that thought that, as he says, that they had been naughty and in multiple ways. And so they did pass the OCR audit with flying colors. So with HCSI, you do have a 30-day money-back guarantee. The company's been around for 30 years. I don't know if we've ever had to give money back. I mean, after you get the binders, after you've gone through compliance officer training and done a risk assessment, I mean, you're going to be set. And this is just such a simple program. But if you feel like it wasn't satisfactory, I mean, if you're being honest with yourself, we're happy to give you a refund. So here's the price breakdown. Okay, the real value of this program is $3,500. Okay. And that's because the compliance officer training, employee training, risk analysis, customized compliance plans, customizable forms, posters, compliance updates with email and newsletter, and then phone and email support is one of the most valuable. At least that's what you tell us, customers, and those of you that we're talking to and don't know about HCSI's support. I'm sure that you'd agree. When you become a customer, if you decide this is a good fit, you'll definitely see the value in that, I think. So right now, HCSI is willing to offer everything I've mentioned to you for $11.89 plus $3 per employee. Now, this after the first year, again, what an auditor or what a compliance officer is going to do is if there's just one, then they'll go in, they'll take compliance officer training. Then they'll go through a risk assessment. They'll customize the policies and procedures. They'll have the staff train. When the binders come, they'll put everything in there. And then they'll do the regular trainings. When we call, we'll be talking to them. And then we will also be providing any updates. So everything is $11.89 right now. You just go to hcsiinc.com and you can check that out. And if you're interested, we'll give you a discount in the month of October that'll give you $200 off. I will need you to email me because I've got a discount code that will get that for you. Okay. Want to say just a couple more things about compliance officer training. Again, going back to that analogy with all those glasses and all the responsibilities that you need to fill, we realize with 168 hours in a week, it's just impossible to do everything. We want you to know we really do become a compliance partner. We see ourselves as a business partner, really, in helping you integrate a culture of compliance. What a value! What a tremendous value! you'll have an understanding the compliance landscape, and you'll have one specific compliance specialist assigned to your account. And so this is an individual that that will be calling you, that will be emailing you. You'll get an introduction if you decide to sign up today. Within about a day is what I've seen. Usually about a day, you'll get a call, an introduction, and kind of an outline and breakdown of other resources that we have with social media. We have a LinkedIn profile, a LinkedIn group. It's a private group for administrators. Many of you are in that group already. And that group is where we publish a lot of our blog articles. We share a lot of content we see within the industry, and it's kind of a private forum. And it really is a private forum. We have a moderator, David Lowe, and I help as well with that forum. But we really make sure that the compliance officer can understand things by unpacking it piece by piece throughout the year so that they don't feel overwhelmed. I've gone to practices where I've seen compliance plans in little cubbies like this, along with other documents and paperwork and pens and a bunch of other things, salami, a lot of things that shouldn't be in there. I say salami because in the bottom middle, it kind of looked like a roll of salami. Anyway, it's time to get organized with your policies and procedures. You know, why put more work into this than needs to happen? You'll have a binder that has everything an auditor wants to see, and at the end of the day, this is going to save you hours and months. Okay. And as the binder needs to be updated, we'll send you the updates. We'll notify you on what changes need to be made. You really are going to be amazed in how much this will help you. I've talked about the quarterly assessment calls. I just want to, again, reinforce that autonomy and engaged compliance officers, that's something that's going to happen. We suspect in about a year. You just can't know everything all at once. And if you're an office that's been discouraged with compliance, yes, there's a lot. Okay, but we're going to give you the necessities, the bare necessities, right, of life, compliance life, and so let us help you in this journey and piece this compliance puzzle together with you. We will be your guide. We want to be. So just feel free to go to hcsiinc.com or email me at lking@hcsiinc.com, or give us a call, 801-947-0183. We'd love to be your compliance partner. This has been a presentation, Leading Your HIPAA Culture in 2016. My name, again, is Lance King. I hope you'll find me on LinkedIn. Connect with me there. I'd love to connect with you over the phone, hear about some of your stories. If you'd like to write for our blog, let me know, and we'll look forward to connecting again soon. I hope you make it a great day, and thanks again for joining us in this training.